Hello everyone, I am Li Guizhu, the Infection Control Nurse of China Medical University Hospital. Today we'll talk about the practice of hand hygiene for COVID-19 prevention. Here comes the outline. First, the importance of hand hygiene. The 5 moments and steps for hand hygiene. Then, the equipment of hand hygiene. Lastly, the implementation of hand hygiene in the institutions. The aim is that everyone could realize the importance of hand hygiene after this lecture. About understanding the 5 moments for hand hygiene and the equipment of washing the hands and sanitizers, as well as to assist the implementation of hand hygiene in the institutions. First, look at the importance of hand hygiene. Cleaning your hands is one of the most effective, efficient, and easiest way to prevent infection, so you have to clean the hands accurately. Secondly is then the prevention of infection in the institution. Thirdly, the blocking of cross-infection by microbes, and then the prevention of contamination by microbes in the institutions. We have to prevent infection to both the residents as well as the medical and caring staff members. Who are the applicable targets and who shall wash their hands? All the staff, including nursing attendants, are required to do so. Not only the employees, though, but also the family members and visitors of the residents, too. So why do we have to wash our hands? From this picture, we can see the distribution of microbes on the skin of the residents and in the environment, too. All these scattered dots on the body of the residents are representing the microbes. There are also microbes on the bedside tables too. The microbes would be transferred from the residents to hands of the staff. But how? Well, upon the approach of taking care of the eldership, like turning over their bodies, tube feeding, or changing the diapers. From picture A, we can see that there are less dots at the beginning, and from picture B, the dots grew more. Therefore, you must wash your hands after contacting with the residents. Due to not washing the hands accurately, such as not completing the proper steps of washing the hands or not washing for enough time, therefore the microbes would still be on the hands. If the caretaker continues to be in contact with other residents, cross-infection would occur. Take a look at this picture. When the doctor comes in to examine the condition of the resident, the doctor examines personnel 1 at first and doesn't wash the hands afterwards, and then continues to examine personnel 2. The microbes from personnel 1 would be transferred to personnel 2. Implementing hand hygiene accurately could reduce the infection caused by microbes. Please look at the 2 petri dishes. Before washing the hands, there were a lot of microbes on the dish. These white dots seen are all microbes, and after washing the hands properly, the dish is now dot-free. Therefore, washing the hands accurately can reduce the infection of microbes effectively. Now let's look at the 5 moments and steps for hand hygiene. Please look at this poster. I believe it appears in many long-term caring institutions. This is a poster made by Taiwan Centers for Disease Control. It says long-term caring for you, the others, and I. The instructions of 5 moments on washing the hands. The first is before touching a resident. The second one is before operating its septic cleaning procedures. The third one is after body fluid exposure risks. The fourth is after touching a resident. The fifth one is after touching the surroundings of a resident. I would explain these movements one after another very soon. This diagram is showing the moments for staff, nurses, visitors, or family members to wash their hands when the residents can totally move by themselves and when not touching the mobility aids. Moment 1 is before touching a resident. Moment 2 is before operating aseptic cleaning procedures. Moment 3 is after body fluid exposure risks. Moment 4 is after touching a resident. In this case, Moment 5 does not apply. And for the current case, the residents could partially move by themselves, meaning that they may require assistance to get off the bed. Then there are 5 moments. Moment 1 is still before touching a resident. Moment 2 is before operating aseptic cleaning procedures. Moment 3 is after body fluid exposure risks. Moment 4 is after touching a resident. Moment 5 is after touching the surroundings of the resident. I will explain the details of each moment now. What would be the details for implementation for each moment? Moment 1 is before touching a resident. I believe the first thing that comes out of your mind is shaking hands or gently touching the arms of a resident. When a resident wants to eat at the dining area, we may have to assist the resident to get off the bed or help with washing. We may have to feed the resident if he or she is staying in bed, or dress the resident when getting off the bed, or putting on clothes for him or her, or massage or turning over the body when he or she has been lying on bed for too long. The medical staff need to measure the blood pressure or before assist in rehabilitation, physical therapy, or turn over the body. These shall all be moment 1. Now let's look at these pictures. For the nursing attendants, first, turning over the body for the resident. We have to turn the body over for the resident every 2 hours. And we will touch the resident while turning it. So please wash your hands properly before doing it. The second is when assisting the resident to get off the bed. Since the residents are encouraged to get off their beds more often, we hope that each resident can get off the bed daily. So the staff have to assist the residents to get off their beds by holding them, and we may need to dress the residents when they get off the beds because it may be cooler outside. If the resident wants to be dressed properly before leaving the room, we assist with combing their hair. If the residents cannot move by themselves, we have to assist on moving them around. These are also the moment 1 when we would touch the residents. And before doing them, we have to wash our hands. Now let's look at moment 2. Moment 2 refers to before operating aseptic cleaning procedures. The first one is oral cavity care, such as brushing teeth for the residents, and if the residents have dried eyes or cataract, we apply eye drops for them daily. So please wash your hands before applying the eye drops. Some residents may be in the beds. They may require phlegm suction. Since phlegm is secretion, the suction is also an aseptic procedure. This also applies when applying medicine to a wound or when the medical staff are installing the nasogastric tube or when installing the urinary catheter for the residents. Before installing tubes are all counted as moment 2. Now look at these pictures for possible situations. The first is brushing the teeth. We have to maintain oral hygiene of the resident. The second is taking in medicine. Some residents may need certain medication. We may have to help them to take the medicine or even feed them. For male residents, we may have to shave their beard on a regular basis. There are a lot of residents who require nasogastric tubes upon feeding, such as feeding milk with the tubes or water. Make sure to wash hands before you apply these actions. We've mentioned that some elder residents may have dry and uncomfortable eyes or cataract and need eye drops. Before applying eye drops to them, the staff must wash the hands, and for the residents using urine drainage bags and also the urinary catheter connected to drainage bags. We have to remove the urine if the capacity of the bag has been filled up to 50%. Wash hands before removing the urine. These are moment 2. Moment 3 is after body fluid exposure risks, similar to what we have just seen, which is before applying the procedures. Moment 3 requires the staff to wash the hands after the procedures, such as applying eye drops, wash hands after applying eye drops, or phlegm suction, wash hands after doing so. Removing urine or changing diapers where there may be urine or stool on them. Don't forget to wash hands after that, or after cleaning vomitus. Removing the nasogastric tubes, removing the urinary catheter. Please do wash your hands after these. This picture shows that moment 3 is after body fluid exposure risks. First, we can see that perhaps most of the residents use diapers. The first moment is after changing the diapers for them. You must wash your hands as they are dirty. The second one is after shaving for male residents. You also need to wash hands again. The third one is what we have just mentioned. When you are helping with tube feeding, no matter if it's water or milk, please wash your hands afterwards. The last one is after removing urine. Your hands would be dirty because urine is considered not hygienic. Please wash your hands after cleaning the urine or urine bags. These are moment 3. Moment 4 is after touching a resident. It is pretty common to be in contact with the residents, so moment 4 is similar to moment 1. After shaking hands, you have to wash your hands. And after helping and assisting them to move, helping with showers, feeding them, dressing them up, or massaging for them, you have to wash your hands. And also after measuring blood pressure, completing rehabilitation, or turning over the bodies for the residents, you are required to wash your hands. This picture shows some common situations nursing attendants would often encounter, such as turning over the body for the residents. After doing so, you must wash the hands. After touching the residents, such as helping them to get on or off the beds, or supporting them when they are moving, or combing their hair when they want to get to the lobby, or helping them to dress themselves up. After doing so, the staff have to wash the hands. These are moment 4. Moment 5 is after touching the surroundings of a resident. Please notice it's touching the surroundings, not the actual resident. For example, when the residents leave the rooms, the staff go in to change or clean the bed sheets, or if the residents cannot get off the bed. We need to adjust the rails of the bedside to ensure the safety of the residents. Even though the staff did not touch the residents, they are touching the surroundings of the residents and also the nightstands. For example, cleaning the stuff on the nightstand shall also be one of the situations on touching the surroundings of a resident. This picture shows moment 5, which is touching the surroundings of a resident. Again, moment 5 refers touching the surroundings regardless of the presence of a resident. The surroundings include the bed, the nightstand, the bed sheet, and the bedside rails. Now let's look at the ways to wash hands accurately. We all know that we have to wash hands with water and clean hands with alcohol sanitizers. So what shall we use? You may use alcohol sanitizers if there's no significant stains or blood on hands. For example, after we have turned the body over for a resident, our hands are unlikely to be significantly stained. We can use alcohol sanitizer for cleaning. This also applies when we are just changing the bed sheets or adjusting the rails. There should be no significant stains on the hands, so alcohol sanitizer would do. But if obvious blood or body fluid are encountered, it is suggested to wash the hands with soap and water or the Sanitizer lotion. The moment would include what we encounter frequently, which is changing the diapers. Because there is likely to be urine or stool on the diapers, so it is suggested to wash the hands with soap and water after doing so. Now let's look at the parts that are often not cleaned properly on our hands. They are shown in orange. These are the most dirty parts of our hands even after washing. You can see it's our fingernails. We can see that fingernails are the hardest parts to be cleaned well. And then we can see the orange part is the thumb. Thumbs are also hard to be cleaned too. And then we have the gaps between fingers. That's why there's a step dedicated to washing them. And also the fingertips shown on gray in this picture. They are also often ignored when we are washing the hands. Next are the back of our hands. People also wash the backs of their hands, but often do not clean them properly. After viewing these parts which are hard to be cleaned well, we shall pay extra attention to these parts every time when we are washing our hands. Many staff don't wash their hands long enough because they are busy to serve the other residents, so they don't have much time cleaning the hands. But in fact, washing hands accurately takes a really short time. In average, it only takes 40 to 60 seconds. In another word, it takes 1 minute maximum. As for cleaning hands with alcohol sanitizers, it takes even shorter. It's like only 20 to 30 seconds. Therefore, washing the hands doesn't take long. There should be no excuse for not washing properly. Then we will talk about washing hands with water or sanitizers. Here is an official poster provided by Taiwan Centers for Disease Control to remind us the accurate steps for washing the hands. The accurate steps for nursing attendants to wash their hands. The first is washing the hands with water and soap, which takes you 40 to 60 seconds. First, you have to rinse your hands and then apply soap to the hands. For step 2, rub your palms. For step 3, rub the back of your hands. Take turns to rub the backs of either hands, including the back of your fingers. Please notice that both hands should be cleaned, so we must rub both of your hands back and forth. Then we move on to step 4, which is cleaning the gaps of fingers, and please rub them thoroughly. Then we move on to step 5, which is cleaning the finger joints. Rub the back of your fingers and the palms of both hands. Step 6, which is cleaning both thumbs and the parts of the palms between the thumbs and the index fingers. Please wash these parts thoroughly. For step 7, you have to wash each and all of the fingertips of both hands thoroughly. Finally, it's step 8. Wash the soap off your hands with fresh water completely. Some of you may think it means the wrists. According to the suggestions and materials provided by the authority, step 8 means a completion. And remember, wipe your hands with tissues. Do not use towels or other alternatives. You can only use tissues to wipe the hands. The 8 steps would take about 40 to 60 seconds. Then let's look at cleaning hands with alcohol sanitizers. The cleaning steps are basically the same, only that we were cleaning with water and soap, and now we use alcohol sanitizer instead. For each cleaning, you only need to apply 2 to 3 milliliters of sanitizer to the hands. Don't use too little sanitizers, it won't have proper results, and don't press the dispenser too many times because your hands would still be wet after rubbing them and completing the steps. First, apply alcohol sanitizer to the hands. The cleaning steps are the same. First, clean the palms, then back of the hands, then finger gaps and finger joints, then thumbs, the fingertips, and then that would be all. When using the sanitizers, the cleaning time is approx 20 to 30 seconds, which is shorter. Since the beginning of 2020, the world is under COVID-19 pandemic. We hope that we can prevent COVID-19 by washing the hands within the institutions, especially in the premises of long-term care ones. Here is the standard operating procedures of epidemic prevention for long-term caring institutions from Health Promotion Administration, Ministry of Health and Welfare. Here are the daily notices for the staff. The first is wear masks at all times. The second is to measure body temperature in the morning and at night daily. The third is to wash the hands accurately and sanitize with alcohol. Washing the hands is also important to the staff members. As the picture shows, the staff will touch the residents when taking care of them, and that's why the staff members have to wash the hands with soap and water or alcohol, or even change the gloves when taking care of different residents. For the moments like what we've just learned, including before and after changing diapers, phlegm suction, feeding with tubes, applying medicine to wounds, assisting with showering, washing the faces, brushing the teeth, making beds for the residents, and also dressing the residents up. These are included in the 5 moments we've mentioned before, and the staff are suggested to review it constantly. The staff shall wash their hands every time before and after assisting the residents when having meals, either with soap or sanitizer. Be sure to wash the hands before eating. That's how we prevent COVID-19 by washing your hands properly. Besides the institutions, you can also find the information on the official site of Taiwan Centers for Disease Control. Maintaining hand hygiene is the first solution to prevent COVID-19. Second is to measure body temperature on a regular basis. Third is to wear masks. To implement effective epidemic prevention, please maintain social distancing and record actual names upon entering and leaving for each person. Then it is required to keep the environment neat and clean. We have to use bleach to clean the interior of the institution on a regular basis, according to what's provided by the authority on hand hygiene. And here is the checklist on prevention implementation in the institutions made by the authority. This checklist has also been used for the infection control inspections in long-term care and correction organizations. In the content, we can see that Point 8 requires the institution to promote the prevention of COVID-19, including hand hygiene, respiratory hygiene and coughing manners, and the vaccination for the flu. All the staff, including the nursing attendant, as well as family members and visitors of the residents, shall be informed of such information. First, we have to implement hand hygiene thoroughly. The second is to comply with the 5 moments of washing the hands accurately for the staff. Then all the supplies for hand hygiene shall not be expired and be sufficient, and it is required to manage the visitors properly by measuring body temperature before entering and sanitizing the hands. Maintaining hand hygiene is the first solution to prevent COVID-19. Now, let's look at the equipment for hand hygiene. They are for complete and accurate hand hygiene. First, let's look at the equipment. We need the faucet to supply water. The faucet shall be able to operate automatically and shall not be manual. The way to turn on the faucet can be by elbows, by paddling, or by censoring, but manually is absolutely forbidden. Then soap is required. You can use liquid soap or solid soap, and the solid soap shall be kept dry at all times. We can now start cleaning the hands. Like what I've just mentioned, wash your hands by the steps. So it is recommended to provide the instructions on a poster to the staff to remind them the steps of accurate hand hygiene. After washing the hands, you have to dry the hands, so there must be tissues. And a trash can to collect used tissues shall be available. In some, we need faucets which can operate without manual operation, tissues and liquid soap, and visible instructions of accurate hand cleaning steps, as well as a trash can for used tissues. Now, let's look at the notices for washing the hands with water and soap. First, you have to keep the sink clean and dry. Please look at the picture on the right. There are many things surrounding the sink. There are scouring pads, bowls, dishes, and beaker flasks. These stuff are not supposed to be there. Nothing shall appear on the sink except for the things I've mentioned earlier. No scouring pads or brushes shall be on the sink too. If you do put them there, please know exactly what they are there for, such as washing the dishes or something else, or for washing the gadgets. Please remember, the sink shall be neat and clean, and it shall not be used for any other purposes except for washing the hands, and the solid soap should be kept dry. If the soap is soaked in water, there would be a lot of microbes on it. For example, Pseudomonas aeruginosa can easily grow in water. If washing the hands with a soap that has germs on it, you will only get a pair of dirtier hands. Next, the tissues shall be placed on the shelf, not on the side of the sink. The reason is that if you put tissues on the side, the tissue can get wet very easily, and the whole pack of tissue may thereby get wet and contaminated. These are precautions for washing the hands with water and soap. Next, let's look at alcohol sanitizer. The authority has a few suggestions for alcohol sanitizers. First, all the institutions are using it. Therefore, sanitizer products must be produced by qualified pharmaceutical companies. Otherwise, the institutions cannot use the products, and the qualified products shall obtain an official serial number from the Ministry of Health and Welfare, and drug permit license are also required. The content shall be alcohol, and as for the concentration, the products contain 70% of ethanol are preferred. If such products are unavailable, products with 70% of isopropanol are also fine. Here is the label of the alcohol product. There is a serial number by the government, which is the serial number being approved officially, which is number 102736. It tells us the content of this product is ethanol, which means ethanol. Next is the drug category. It is considered as a drug. The date of opening it has to be recorded. If you open the seal today, please record the date on it. If it's unopened, which means the expiry date is the shelf life. For example, this product expires on 11th of February 2024. For divided products, they would expire within a month. And you must be aware that alcohol is volatile, explosive, and flammable. The material safety data sheet showed us those information. The exclamation mark means the product is considered dangerous. The flame sign means that it is flammable. Here is a material safety data sheet. You can look it up by yourself. You can see that the chemical name is ethanol, and there is the flame sign and an exclamation mark. This sign says the chemical is flammable and it's very dangerous. Because the content of the sanitizer is alcohol, so everyone must be careful on how to store the sanitizer and shall not eat or smoke at working areas. The empty containers may be toxic, flammable, explosive, or vapors, and do not unawarely cut, shred, or recycle them. unless the potential danger could be adequately prevented. The storage is also important. You have to store the alcohol in the containers that are tightly sealed because it is highly volatile. Secondly, please store in a dry, shadowed, and isolated area with good ventilation and away from thermal sources. I would like to tell you what I've seen in some institutions, storing alcohol products in a metal sheet room on rooftop because they didn't have warehouses. But metal sheet room does not have air conditioning and it can become really hot just by exposing to the sunlight. In this case, it would be dangerous to store alcohol inside it because it can explode if it's being overheated, so please store the products in dry, shadowed area with good ventilation. It is convenient to clean the hands with alcohol sanitizers, but there are also some safety concerns. Please beware of the location for installation of dispensers. Do not install the dispenser near plugs, sockets, or switches, because when the plugs or switches operate, there might be danger. More specifically, starting from the center point of the installation location, you should keep the dispenser away from power switches or plugs for at least 15 centimeters. And you cannot install the dispenser above any power sources. Secondly, you must keep the dispensers away from heating equipment that can produce a temperature of over 49 degrees. Keep the dispensers away from heaters. Pay additional attention to the locations where heaters are. Please also keep dispensers away from flames. For example, keep dispensers away from gas stoves or gas equipment for at least 1 meter. And lastly, please pay attention to the height of the installation. When installing the alcohol dispenser, please make sure that the liquid will not reach the eyes upon spraying. You must install the dispenser at a height lower than the eyes. As for the 4 C's of hand hygiene, correct movement refers to the 5 movements. You must not just wash your hands under supervision. Whenever any of the 5 movements happen, you have to wash the hands. Correct ways refers to washing the hands accurately, like we've just learned, either washing with water and soap or with sanitizers. If your hands are dirty or you've just finished changing the diapers, you need to wash the hands with water and soap. If you're helping a resident, you only need to wash with sanitizers. Correct steps refers the steps we have already explained. You must complete each step and not miss any of them. Correct time refers to correct time durations. For washing with water and soap, it's 40 to 60 seconds. For cleaning with sanitizers, it's 20 to 30 seconds. Now, where can you look up for the instructions? You can find the instructions at the official site on Taiwan Centers for Disease Control under Disease and Conditions. Then click on the link of Regular Assessment for Infection Control by Long-Term Caring Institutions. You could see the related documents. You can access to each assessment to the institutions. There is also regulations to installations of hand hygiene equipment. Take the 2019 Assessment Guidelines of Infection Control by General Nursing Homes as an example. Item 6 refers to the installation of epidemic prevention mechanism. As for point 2, sufficient and adequate supply of hand hygiene equipment are being mentioned. It talks about the requirements of hand hygiene equipment and practice. The assessment includes equipment for cleaning the hands with water and soap, or alcohol sanitizers dispensers are required to be installed at each room or dining areas. Or the staff may carry the alcohol sanitizer sprayer at all times instead. Then there shall be faucets to supply water as well as the soap, lotion, and tissues for washing the hands. Remember, the solid soap must be kept dry, and it is important to clearly label the packaging date if the dose of alcohol sanitizer has been subpackaged. It shall expire within 1 month after packaging as a principle. Please refer to related regulations by the authority. I personally recommend extra installing of the equipment for hand hygiene. First, at the main entrance of the institution, there should be an equipment for visitors and family members to clean the hands upon entering, as well as consider the layout of the institution. Washing with water and soap is preferred, and only when it's unavailable, alcohol sanitizers will do. Actually, you do see alcohol sanitizers being used all the time when entering the institutions. Then, as for the nursing station, it is recommended that equipment for cleaning hands with water and soap is preferred. Only when it is unavailable for the institution, then you shall choose to clean the hands with alcohol sanitizers. But anyway, alcohol sanitizers shall be always available. Moreover, there are a variety of utility cards in the institutions, such as medication cards, diaper cards, or cards for tube feeding. It is highly recommended to provide alcohol sanitizers to those kind of cards for the staff. Now, please look at these pictures. I believe you are all familiar with these kind of cards. On the far left is the diaper card, and here is the alcohol sanitizer. Elderly residents don't usually get huge wounds, but there are often minor ones. And before and after applying medication to the residents, the staff need to use alcohol sanitizer on the cards. Remember, this is the so-called moment 2, and please remember to wash the hands. Then it's the feeding card. We can use it to feed the residents water or milk by using the nasogastric tube, so there should be an alcohol sanitizer available too, because that's moment 2. Then on the near right is the emergency card. If there are emergency cards in the institution, the alcohol sanitizers should also be available. And the last one is blood pressure card. If there are blood pressure cards in the institution, alcohol sanitizers are also required. The staff need to wash the hands before measuring the blood pressure of the residents. This is the moment 1. It is recommended that all of these cards shall be equipped with alcohol sanitizers. In addition to the alcohol sanitizer we've just mentioned, we may carry portable ones so that the staff can put it in the pockets and use it at any time, anywhere when it's required. That's when portable sanitizers come in handy. Now let's look at examples of the moments for staff of long-term institutions to wash the hands. The staff include nursing attendants and caregivers. First, when assisting the residents to get off beds or sitting on wheelchairs, we greet the residents to inform them that we are going to help them to get off the beds. And after we adjust some equipment, we need to wash the hands. It's considered moment 1. And then we can assist the residents to get on or off the beds or sit on wheelchairs. After that, we will need to wash our hands again before assisting further. This is due to moment 4, that we have just touched the resident, so we must wash the hands before further work. Then it comes to turning over the body for the resident. Also, we greet the resident first, that we are going to turn over his or her body. Before it, we have to wash the hands. This is moment 1. Wash the hands before you touch a resident. After that, we could assist further, either to the left side or the right side. After that, we need to wash the hands again. This is moment 4. Wash the hands after you've touched a resident. We shall record notes after it. Then it's feeding with tubes. We often feed water or milk to residents using nasogastric tubes. After greeting and setting up the equipment, we need to wash the hands immediately. This is moment 1 before touching a resident. After that, we then assist the residents to get to the right position. Then we wash our hands again. This is moment 2 before cleaning or operating aseptic procedures. After that, we feed the residents with nasogastric tubes. Then we wash the hands again. This is moment 3 after body fluid exposure, but such moment 3 is optional if you haven't touched any fluid. Then we help the residents to get back to the original positions. After that, we wash the hands again. This is because we've just touched them. And this is moment 4 after touching a resident. Then we finish writing up the notes. Here is the example of oral cavity caring. After setting up the equipment, we need to wash the hands. This is moment 1 before touching a resident. After that, we assist the resident to get to the right position. Then we need to wash our hands again. This is moment 2 before cleaning or operating aseptic procedures. Then we put on the gloves to examine the oral health of the residents. Sometimes we even need to brush the teeth for the residents. After that, we could take off the gloves. We need to wash our hands again. This is moment 3 after body fluid exposure. We assist the residents to get to the right position, and then wash our hands again. This is moment 4 after touching a resident. We make the notes then. Then it's changing the diapers. As usual, we shall greet the residents that we're going to change diapers for them. And then we also carry clean diapers near the bed. Then we wash our hands. This is moment 1 before touching a resident. After that, we put on the gloves, roll up the quilt to expose the lower part of the body, and then remove the old diapers. Fold and throw them into the waste container or trash can. Use the wet wipes to clean the lower part of the body, and then throw them into the waste container or trash can along with the gloves. We must wash our hands again then. This is moment 3 after body fluid exposure. Then we put on clean diapers for the residents as quickly as possible, plus assist them in getting back to the original positions and cover them with quilts. We will wash our hands again. It's moment 4 after touching a resident. Now it's using the urinary catheter. As usual, we greet the residents that we are going to clean urinary catheter for them, and then we put the equipment near the bed. We then need to wash the hands because it is moment 1. We remove the pants for the resident, assist them to get to the right position. And then we have to wash the hands again because it is moment 2. We use sterile cotton swabs for cleaning and sanitization. After that, we take off the gloves. And then wash our hands again. This is moment 3 after body fluid exposure. After that, we need to help the resident to put the pants back on. After helping them with that, we assist them to get back to the original position and wash our hands again. This is moment 4 after touching a resident. Then we make further notes. Now it comes to washing the private parts for residents. As usual, greet the residents that we are going to wash the private parts, and also we carry the equipment near the bed. We need to wash the hands, as it's moment 1 before touching a resident. Then we assist the resident to take off the clothes and get the resident to the right position. Then we have to wash the hands again. This is moment 2 before operating aseptic cleaning procedures. After that, we put on the gloves. We use the cotton swabs and wash the private parts. After that, take off the gloves. We wash our hands again. This is moment 3 after body fluid exposure. Then we assist the resident to put the clothes and pants back on and help them to get back to the original position. We wash our hands again. This is moment 4 after touching a resident. Then we take further notes. Now it's applying medication for the residents. First, we greet the residents that we are going to apply medication on them, and then we put the equipment or the medication cart near the bed. We need to wash the hands because it is moment 1 before touching a resident. After that, we expose the wound of the resident as well as removing the clothes covering the wound. Then we need to wash our hands again, because it is moment 2 before cleaning or operating aseptic procedures. Then we put on gloves, remove the original medication on the wound, and then we take off the gloves, wash the hands again. This is due to 2 moments, which are moment 3 after body fluid exposure, because we've just touched the wounded part of the body, and there's also moment 2, because we're going to change new bandages and apply medication for the resident. So this is moment 2, which is before cleaning or operating aseptic procedures. After washing the hands, we put on gloves, and then we sanitize the wound and use gauze to cover it. Then we take off the gloves. Wash our hands again because it is always moment 3 after taking off the gloves, which is after body fluid exposure. We put the clothes back on for the resident and assist the resident to get back to the original position. We need to wash our hands again, and this is moment 4 after touching a resident. Then we take the final notes. Now we've just learned the standard operation procedures of hand hygiene in the institutions. We can see that teamwork as well as cooperation between the government and the person in charge of the institution is crucial for implementation of hand hygiene. It's already half the success if they can actively participate in the promotion of hand hygiene. Then we need sufficient equipment for hand hygiene so that the staff can easily clean their hands. To clean their hands thoroughly, you need to provide sufficient hand hygiene equipment. And then, the institution may need a staff dedicated to promote hand hygiene. Just like Taiwan Centers for Disease Control has been working with Infection Control Society of Taiwan to develop the training program of personnel dedicated to promoting hand hygiene at the long-term caring institutions. It also promotes hand hygiene for long-term care institutions and provides trainings for hand hygiene. We can provide certificates for participants. It's important for the institutions to promote it with trainings, since such trainings are one of the most important parts for improvements on hand hygiene. All the staff must participate in the training. The training includes the 5 moments for hand hygiene and the correct steps for washing the hands, which are the steps we've just learned. The program can be done in workshops with discussions, or we can find out who has the right or wrong concepts. For example, we can see who knows the correct steps to change the diapers and who has the wrong concepts regarding something else. We wish to see significant results from the trainings. Therefore, they should be examined. There are 2 parts of the audit. The first is to audit the compliance of the 5 moments. The second is to audit the correct hand hygiene steps. After the audit, feedbacks will be given to the institutions, and regular meetings shall be held to discuss the audit results to see how the implementation of the training is, and what haven't been done well and needed to be improved or recertified, which would all be discussed further. A poster displaying the 5 moments and correct steps for washing the hands shall be seen within the institution, because it can constantly remind the caring attendants of the importance of hand hygiene, including the 5 moments and the correct steps to wash the hands. So we hope that we can build a common sense relate to accurate concepts of hand hygiene within each institution. We hope that the institution could organize forums for family members to participate, or we can organize a contest of hand hygiene. That's all for today. The lecture is over. Thank you very much.